Hello, welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about what do I do if I have a prolapse. So traditionally, doctors tell their patients and physical therapists tell their patients do more Kegels. But a prolapse, if you watch the previous videos, is the organs are starting to come out. And if we talk about anatomy, these organs are held up by ligaments from above. And so if we're tightening from below, they're not attached to our muscles. So that doesn't always work. But the theory for a long time was like, oh, we'll tighten to support this. But really, this is held from above. So the prolapse is caused by either like one of these ligaments is broken or it's stretched out. So what I find is sometimes Kegels, but more often than not, these pelvic floor muscles are too tight and they're pressing on this organ that's coming out. So that doesn't always help. So usually for my patients, we do some pelvic floor work to stretch this, soften these muscles, and just kind of create better space for where this organ exists at the moment. The other thing I find for my pelvic floor patients, my patients with prolapse, is leg strengthening. Really like strengthening these big muscles on the outside really helps. Sometimes Kegels, sometimes, but it's usually not the starting place. So number one, stretching, softening these muscles, creating more space, strengthening the big muscles. And that's kind of the main things we do in physical therapy. And if that's not enough, then I'll have my patients see their doctor. Some physical therapists can do this in some parts of the world. It's more common than in the US. It's kind of new in the US, but you can get fitted for what's called a pessary. So a pessary, there's a bunch of different kinds, but basically they support the organs inside the pelvis. So it kind of puts it back into where it should be. And then you could strengthen the pelvic floor muscles. But if this is constantly pushing out, it's basically pushing down on the muscles and then we're trying to strengthen. So it's like this tug of war and it's not getting stronger and this is not getting better. So that's why creating more space, strengthening around it usually helps. And then if you need more support, a pessary will help support it from the inside. And surgery is the last option. There's also different support garments. There's a lot of like bike short type things or underwear that have elastic or like some little belt things, kind of like some of my patients call it like a female jock strap that support this from the outside. That also helps a lot of my patients. I'm not a huge fan of surgery. If you need it, you need it. If you have a grade 3 or 4, absolutely. Physical therapy is not going to be enough. But if you have a grade 1 or 2, stretch the pelvic floor, soften the pelvic floor, strengthen your hips, strengthen your legs, practice proper breathing, avoid constipation the best you can. Those are the things that are going to help you. And then maybe get support shorts, support garments. I'll link some in the below. Or get a pessary internally. Like those are the things that are going to help a grade 1 or 2. Surgery, not really. But if you have a grade 3 or 4, absolutely you need surgery because that means, again, one of the ligaments that's suspending the organ is broken. And so there's no way we can rebalance that. So hope that helps. I'll link to my other videos about prolapse and to some support garments below.